The Association of American Medical Colleges Careers in Medicine Program, or SIM, is a comprehensive career planning program that provides medical students and their advisors with the tools, information, and resources to choose a specialty and residency program that meets their education and career goals. This video is intended for medical students to learn more about SIM. We will review the research behind SIM and engage in a website tour so that you, as a medical student, can navigate the resources available to you through your institution's AAMC membership. So, what is SIM? AAMC surveys show that 2/3 of medical students enter medical school either undecided about specialty choice or change their mind over the course of medical school. This indicates that most students need meaningful information and guidance to consider and evaluate specialty, training, practice, and other career options. The SIM program was designed specifically to help you as medical students make the most informed and well-reasoned specialty, training, and career decisions possible, and to support your medical school career advisors in facilitating that decision. The research-based 4-phase career planning model is the foundation of the SIM program. SIM was created based on research and vocational theories, which posit that if people actively engage in choosing their vocations rather than leaving the decision to chance, they are more satisfied with their careers. This conceptual framework is now known as the theory of person-environment fit. The Venn diagram on this slide is a visual illustration of how various vocational theories merge together to aid in making fulfilling career decisions. This graph is from the AAMC Graduation Questionnaire, which is completed by U.S. graduating MD students every year. According to the GQ, there are several factors that go into making important decisions about specialty and residency, but 99% chose fit with personality, interests, and skills, and 98% content of the specialty as the top 2 factors. This is consistent every year, and these factors correlate well with career and vocational theories and research. The SIM website is structured around the 4-phase career planning model, but it is important to note that the phases do not necessarily correspond to the 4 years of undergraduate medical education. The phases are color-coded as a guide to the resources that correspond to each phase. You can see the menu across the top of the homepage has a section for each phase. Most users navigate using the top menu, as this has drop-down menus for each phase with subcategories available. During the website tour, I will show you the drop-down menus and links available for each phase. The first 2 phases are the information gathering phases. The information gathered from one phase informs the other to create a cycle of exploration of self and options. Understanding yourself is the self-actualization phase, and this is the foundation of the process. In this phase, you are encouraged to identify your values, interests, and skills as they relate to your career in medicine. The next phase, Explore Options, is the one in which students are typically most comfortable. This is the phase where you gather data about your options. Once you have gathered enough information about yourself and your specialty options, you are able to make a data-informed decision and choose a specialty. In this phase, SIM provides you with the resources to synthesize what you have learned about yourself and the field and make a specialty decision. Finally, preparing for residency provides you with the resources to implement your specialty decision and match into a residency program that is a good fit for you. Just as self-assessment is the foundation of the 4-phase career planning model, the assessment dashboard is the foundation of SIM for you as a student. This is where you can find all the self-assessment exercises that will assist you in thinking through your interests, values, and skills and connecting your results to medical specialties. We'll talk more about these during the website tour. You can then learn about your specialty options through a comprehensive repository of medical specialty profiles. The self-assessment tools and the specialty profiles are supplemented by a variety of articles with topics such as getting started with SIM, how medical students choose specialties, and why applying to more programs is not necessarily better. Many of these articles were written by expert faculty advisors at U.S. medical schools. The SIM resources also include videos and webinars that are helpful to medical students in all 4 phases of the career planning process. Finally, SIM includes opportunities for reflection and journaling. Now that you have a general overview of the SIM program and resources, we're going to take a tour of the actual website. The SIM website has nearly 500 pages of content covering the myriad of topics relevant to medical student specialty choice and transition to residency. To orient you to the site, I'll highlight the key resources in each phase, then encourage you to continue exploring on your own. To access the full site content, you must sign in with your AAMC username and password. If you don't know your AAMC username or password, you can find it by clicking on the Forgot Your Username and Forgot Your Password links on this page. Clicking the top menu will show the drop-down menu with links for all resources in each phase. The first phase in the career planning process is Understand Yourself. The About Assessments page provides resources to support you in understanding the value of self-assessment, how to apply self-assessment results, and the SIM assessments available. The At a Glance infographic provides quick guidance in understanding the basics of each assessment. The assessment dashboard is the most comprehensive and convenient location to access all assessments and prior assessment results, so I'm going to spend some time there. Through the assessment dashboard, you can start a new assessment, complete an assessment, or access previous assessment results in perpetuity. You can take the assessments multiple times, and we highly recommend that you do so. The results of each assessment are available on this dashboard. According to SIM user data, the assessments most used by first and second year students are the Medical Specialty Preference Inventory, or MSPI, the Physician Values and Practice Scale, or PVIPS, and the Physician Skills Inventory, or PSI. The MSPI assists you in identifying your interests in medicine and recommends specialties that reflect those interests as a starting point for exploration. The MSPI is a self-assessment that uses 150 items to measure preferences for various activities, tasks, and experiences found in the field of medicine, and compares those preferences to 19 specialties entered after medical school and to 18 areas of medical practice. We recommend you complete the MSPI in one sitting, but you can also save your work and resume later if needed. Once the MSPI is completed, the MSPI report is immediately available by clicking on the View Full Report icon in the upper right corner. The first page of the MSPI report shows the medical specialties that best match your answers. In the case of this sample student, their MSPI results indicate that internal medicine, emergency medicine, and anesthesiology are the top 3 specialties they might want to explore further. The second tab of the full report measures your interest in specific areas of medical practice and allows you to compare your interest to specific medical specialties. Note that all individual student assessment results are private and only accessible to each individual student, but you can share your results with advisors or others by either downloading and printing a report or emailing the results. This is the email template that can be used to send results to anyone you choose. The next assessment is the Physician Values and Practice Scale. The PVIPS uses 60 statements to help you identify and prioritize values and the work settings and environments that best reflect those values most. The PVIP's 6 core values found in physician careers are autonomy, management, prestige, service, lifestyle, and scholarly pursuits. The PVIPS results help you think about how you want to practice medicine in your chosen specialty, rather than help you decide what specialty to choose. The Physician Skills Inventory, or PSI, supports you in understanding your skills in selected areas important to the work of a physician and identifies those areas where you can improve. The self-assessment uses 47 skill statements and descriptions to measure strengths and weaknesses in 3 major transferable skill areas: psychomotor skills, problem-solving skills, and counseling skills. In addition to increasing self-awareness, the results can improve knowledge and understanding of the basic skills necessary for practicing medicine and help you identify areas for further development. The PSI report allows you to compare your skills to broad specialty groups: primary care specialties, surgical specialties, technical specialties, and medical specialties. After choosing the specialty group from the drop-down menu, the resulting chart will show your answers in the red diamonds as compared to the range of skills for that specialty group. Once you have completed your self-assessment work, you can use Phase 2 resources to learn about your many specialty options. SIM specialty profiles are the most visited pages by medical students. SIM specialty profiles contain information and data for over 160 medical specialties and subspecialties. You can search for a medical specialty alphabetically or by training path. Once you have chosen the specialty or subspecialty to review, there are up to 7 tabs of data and information. The Overview tab compiles descriptive data and the data most interesting to students when first considering a specialty, and displays them here for a quick glance. The Work tab features data about the specialty's patient load and patient visits, as well as lifestyle data, including a rating of the on-call schedule as compared to other specialties, average hours and weeks worked per year, and the satisfaction of physicians in the specialty. The Salary tab displays salary information for both academic and clinical practice for most major specialties. The Training tab reports details about training in the specialty, as well as data about training programs and recent cohorts. The Competitiveness tab features data to assist you in realistically comparing your qualifications to those of residents in specialties you're considering. The data includes Step 1 and Step 2 data, research experiences, and other characteristics of recent residents. The Workforce tab provides data about the current specialty workforce. Where available, there are also excerpts from various workforce studies providing demand projections for specialties. Finally, the Resources tab provides links to that specialty's societies, boards, publications, and other organizations so you can find more information about the specialty. This is a useful resource if you are looking for opportunities to get involved in professional organizations or find scholarly activities specific to a given specialty, or to publish or present your work. The Explore Options phase also includes specialty spotlights. These specialty spotlights are day-in-the-life articles describing what it's like to practice in each of 27 specialties, as well as in-depth information about the varied practice settings and other career options available. Also in the Explore Options phase is the Compare Specialties tool. The Compare Specialties tool allows you to choose up to 3 of the major specialties and view select data points side by side. This might be particularly useful for third-year students who are trying to narrow down a specialty decision. While the Specialties Options section is the most popular section for researching specialties, there are many other important resources in Phase 2 to support you in specialty exploration. One of the resources under the Explore Options phase is the Clinical and Research Opportunities Database. This database features summer and year-round programs that can help you experience and gain the knowledge you need in the specialties and practice settings you are considering. Phase 3 of the SIM career planning model is Choose Your Specialty. The resources in this phase will assist you in connecting your self-assessment work with the information you gained about specialty and practice options to make a specialty decision. Because the decision-making process is complex and unique to everyone, the resources in this phase provide you with a variety of decision-making strategies. This section also includes a self-assessment exercise, the Specialty Indecision Scale, or SIS. The SIS can be useful for medical students who are having difficulty choosing their career path. The SIS uses 35 statements to measure 6 major areas of concern common to medical students considering and selecting specialties: readiness, information, identity, barriers, indecisiveness, and self-doubt. The SIS results identify areas of concern and offer suggested activities to consider and implement based on your major areas of concern and your progress in medical school. We encourage you to share your SIS report with your advisors for additional assistance in working through specialty decision barriers. Modeling the decision-making process is shown to be an effective tool for helping medical students make decisions. Phase 3 features videos and written reflections of physicians' own specialty exploration and specialty choice. The fourth career planning phase is implementation, and this section of the website includes tools and resources for choosing residency programs, creating a smart residency application strategy, interviewing, and matching. In choosing programs, you will once again utilize a self-assessment, the Residency Preference Exercise, or RPE, to think about your residency training goals and select programs that will meet those goals. The RPE is a great tool for helping you consider what you want out of your residency training and find programs that meet those criteria. The RPE asks you to assess the desired attributes for your ideal residency program related to areas such as educational opportunities, clinical duties, patient care, staff characteristics, and work environment. The RPE is most useful when completed at several key decision-making points during third year and fourth year. At the beginning of third year as a base point, midway through third year when choosing fourth year electives, and at the beginning of fourth year when creating a list of programs you might apply to. You can create as many RPE preference profiles as you want and can name each profile so they can be easily identified later. Once you have created the list of residency program characteristics most important to you, you can use your profile to identify the residency programs that could be a good fit for your needs. Once you have completed interviews, you're able to go back to the residency preference exercise and create program lists. Then you can rate and rank the residency programs within your program lists. One of the ways you can explore residency programs is to learn how you compare with other matched applicants in your chosen specialty or specialties. Phase 4 includes a link to the AAMC Residency Explorer tool, as well as to many articles that can help you create your list of residency programs you might apply to. Applying for residency programs involves developing and assembling a residency application and supporting documents that will present one's best self. The Apply to Programs section of Phase 4 provides an overview of the application process and includes articles with advice for completing each section of the residency application. The next step in preparing for residency is interviewing, and this section offers a variety of resources from preparing for an interview to interview follow-up. Once you have completed interviews, you're able to go back to the residency preference exercise and use your profile to compare, rate, and rank the residency programs with whom you've interviewed. The final section we'll review is the Quick Links menu. The Quick Links menu allows users to find the most frequently used pages of the site. Users can bookmark key articles or information and then quickly navigate back to those articles using the Favorites menu. When you find an article you like and you want to bookmark it, click the bookmark link, available on most articles and pages of the SIM website. Then, you can navigate back to that article from your saved favorites. The Quick Links menu also links to a form that can be used to directly email the Careers in Medicine team. We encourage you to use this form to get help with access issues, ask questions about the SIM program and resources, share feedback about existing resources, and offer suggestions for additional resources. This concludes the Careers in Medicine website tour. Thank you for watching, and please reach out with any questions.